Dr. Paul here. It is COVID season, and so we're honoring that process of protecting our patients. We're gonna go see a 2-month-old baby, cute as could be. This is a well visit. Hi, how you guys doing?
Hey, how you doing?
Hey, good. Now I happen to know that you guys have the best smiles, but I can't get you to smile because you can't see my smile. That's the problem with these darn masks.
Exactly.
But
you gonna
oh
smile
well.
for him, Tosh?
It is what it is. So this is our 2-month visit.
Yes.
You guys are doing
excited.
well?
Yes.
That's
She's doing
awesome.
so good.
That is awesome.
Progressing well.
Doing well. And the feeding, is it, what are you doing for feeding?
Yeah, every 4 hours now.
Every 4 now? Okay.
Yeah, so she's not as frequent, but yeah, she eats good.
And what is she eating?
Breast milk, strictly.
Pure breast milk?
Yep, rarely
All directly,
bottle.
or are you doing some bottle?
Directly, and then bottle when you don't have to step away and someone else has to take over.
So daddy gets to do some bottle feeding?
Yeah.
Once in a while.
Okay.
Yeah, but mostly breast.
All right. Well, what I used to do for my wife at this age is, you know, you can be pretty tired from constant breastfeeding. If you happen to be able to send her to bed early, and you can stay up, you know, you do a breastfeeding and go to bed. If you are a late night person, but you're an early morning person.
Yeah, I'm early morning. Yeah.
So I don't know how you help that situation. You're both going to bed at the same time.
Right, well, she stays up late.
Oh, you stay up late.
Yeah, but he likes to go to bed early.
Okay.
So
maybe in your situation, if you're an early riser, you slide the baby out to the other room. If baby's still sleeping, you take your shower, get ready for work, top the baby off with a bottle of breast milk before you go off to work. Slide baby back with your mama, and maybe you get to sleep in.
Yeah,
It's
that
just
would
a
be
thought.
nice.
That could work.
No, that's true.
Yeah.
That's not a bad idea.
I
at
like
all.
that idea.
If you can sneak one feeding in either at the end of the night or the beginning of the morning, so mom can sleep through and get a stretch.
Right.
Yeah.
Okay.
Is there such thing as her like rejecting the bottle since she's almost strictly breastfed?
Well, you'll find out.
Yeah. Right.
My babies never gave me a problem with the bottle.
Okay. Oh, bless you. Okay.
But I have heard of that happening.
Yeah.
So it's a good question.
Yeah. Okay.
In general, though, it'll probably work out fine.
All right. Great.
Yeah. Now, 2-month-olds. Oh, look at that picture. That is a picture of beauty right there. Quick break for a word from our sponsor, Let's Get Checked. If you've experienced fatigue, lack of energy, you're having sleep problems, you're having anxiety, depression, mood disorders, you can get your answers from the comfort of your home without needing to see a doctor by using Let's Get Checked. So there will be a link in the description below of a various number of panels that I recommend. Things like essential vitamin and nutrient panels, things like hormone panels for males and females. There's even a kit for Lyme disease. You should take advantage of as many of these as you can. This is the way that integrative medicine works. And not only that, Let's Get Checked will have a doctor review your labs, have a nurse call you, and in some cases, the doctor will even make prescriptions for you. So it's an amazing program. I'm using it myself in my own home. I've got family members using this program. You get a 20% discount by accessing using my code, DrPaul20, DrPaul20. Check the links in the description and go ahead and get yourself tested in the areas that you feel you might have the most need. All right. Hi.
Hi, Dr. Paul.
I sure wish I could take this mask off and get you to smile. So some 2-month-old will roll over. I don't know if she's rolled over yet.
From her, from her stomach to her back.
She has? Okay.
Yeah.
Cool. So I'm feeling for a femoral pulse, and it's totally normal. You do that because very rarely blood that's flowing out of the heart is not getting around the aorta properly, and so that picks that up if there's a problem, and it's good. I'll start at the top though. Usually we start at the top. Fontanelle, that little soft spot, it's almost closed. I can feel a little finger point indentation, which is totally normal. And we're so cute and inquisitive. With the eyes, I'm watching, tracking. So if you look at the reflection of my flashlight relative to the pupils, we're so attentive with the camera.
Right, you're like, do I look at the camera or the light?
So you know what light I can use is the reflection of the light up above. You can see it on the eyes. And relative to the pupils, it's in the same spot.
Okay.
You, Mama. Yeah. Go ahead and try to get her attention.
Tosh,
There we go.
Hi, babe.
So I saw the reflections moving nicely with both eyes.
Okay.
You are a magnet to that camera.
I don't know that any 2-monthers ever paid this close
That
attention.
close of attention.
Really?
Yeah, she's very attentive.
She loves TV.
We almost never look at the
Oh
camera.
my gosh, that's impressive.
It's in her blood.
Okay. All right. So I'm going to look at head control here. Look at that. That's really good head control for a 2-month-old.
What does that mean?
That's just if you have a baby that's floppy for some reason, their head will just flop back, which is not necessarily a good thing. So that's nice and perfect head control. See that?
Yeah.
That's
good
great.
Job, Todd.
Let's see your mouth. Oh, that's a good mouth. That little bit of white on the tongue is normal.
Okay.
That's just breast milk coating the tongue.
Okay.
Some people will wonder, well, might that be thrush, which
Right.
is yeast?
I did ask the last visit.
If it's thrush, it's going to also be in the gums. So pull those gums down and you don't see any white. It's also going to be in the cheeks. So you can look in the cheeks and up here. And there we go. I can get a good look at the cheeks. It's just on the tongue. Sorry, honey. That was a lot of poking and prodding. Hi.
You're doing so good.
So happy.
She's usually a talker too. She just coos and just.
Hi. Hi. Like
You gonna say hi? You gonna
this
talk?
is different. This is different. We're gonna feel your tummy. If I jiggle the legs, usually I can get my fingers in there and feel for masses, which I almost never feel. And that feels normal. What are the bowel movements like at this point?
Oh, always.
Frequent.
Lots of them?
And large.
My kind of girl.
All right.
Very large.
And we checked the pulses already. Hips are good. I'll flip you over and look at that backside. Ta-da! Okay. Actually, let's let you... So tummy time's good, right? So they get some little practice pushing up. There's sort of some birthmarks. You see those? Those little darker pigmented things. Right there, right there, right there.
A lot on her booty.
Even there. And then that's the common spot, right?
Yeah.
Why is that the common spot?
I don't know. It just is. You know, generally darker pigmented individuals have more of these flat pigmented nevi. They used to be called Mongolian spots, but that's not PC. And they're totally flat and they're totally harmless. It's just increased pigment. And it will fade over time, but this one for sure will still be there.
Yeah.
And those might be slightly.
Okay.
And so there's been stories in the past of teachers saying, oh, this kid's been beat, right? These are bruises, because how can you distinguish it?
Right.
So having it in the medical record is important for that reason,
Agreed.
in case some over-attentive teacher tries to someday say that this child's being abused, which if there ever was a child more loved, I haven't found one yet.
Right.
We know this baby's just so adored. All right. So, we got a perfect kiddo here. Yay! Perfect kiddo. All right. So, what do you think, Taj? What do you think? Yeah, it's just hard to say. Now, can you look both ways? Can you look that way? Because some kids prefer to look a certain way.
I have noticed
So
that.
I'm going to try something. I'm going to flip her the other way. Oh, she just likes the camera.
Yeah. If you bring the camera on this side, pop her head over.
Look at that.
Yeah.
She likes the camera.
She likes to sleep on one side more than the other, that's for sure.
Yeah, I mean, if it's excessive, you'll get flattening of the head on one side more than the other.
Okay.
I think we're pretty good here. And you can actually have the skull temporarily a little lopsided. But, yeah. Yeah, I'm going to do a little...
Explain what you're doing there.
I'm doing a little gentle traction, if in case the head, maybe during birth, you know, there's a lot of compression, and you get a pinched nerve that kind of triggers the head to go to one side. By doing some gentle traction, holding the back of the head and just pulling till we slide. And turn the head a different way. Uh-oh, you prefer that way? No. She's fine.
Yeah.
Because see, when I move the camera, she goes the other way.
Yeah, right.
She's ready for the modern world.
She's
Yes,
ready. She is ready. All right. So, perfect. And you're enjoying Taj, I imagine.
Oh,
I can tell.
Yeah.
So much.
Are you feeling overstressed at all by any of this?
No.
I saw your screening, and you have a perfect score for the depression scores. You have nothing.
That's great.
You're like
that's
loving
Yeah,
it.
I really enjoy being home with her.
Oh, that's so cool.
Yeah.
It is So
I jokingly say I'm just gonna have another baby just so I could have maternity leave. Just stay home.
Oh, that's awesome. Well, I tell you, you know, it's not too complicated at this particular age. I mean, it's all about feeding them, and you're doing that beautifully with breast only every 4 and perfect weight gain. Latch is okay. You're not in any pain.
Nope.
Okay. So motor skills, it's lifting the head, which we've already seen. Some kids at this age will start to grasp something, right?
Yeah. Finger. Yep.
Yep. And sensory-wise, she responds to noise and voices.
Yes.
And the cooing that you've expressed that she's doing.
Yes.
And we've already seen her tracking, although she mostly likes to watch the camera, but that works. So communication, you're getting social smiles. I saw a hint of it, obviously, with our masks. It's a little harder to see those.
Right.
And really, that's about it.
Oh, good.
That's about it developmentally, and the development starts progressing, obviously, faster and faster. Right. So for nutrition, it's breast only till at least 4 months.
Oh.
So we add solids somewhere between 4 and 6 months.
Okay.
So just keep doing what you're doing. I would supplement with vitamin D, 1,000 IUs per day.
Okay.
And we have that here, D3 with K2. And yeah, besides that, the 2-month visit's the visit where we talk about vaccines. So we're going to have that conversation privately, obviously, because you know, parents have the option of what I call informed consent. So you're given the pros and the cons, and then you make your own personal decision about that. The CDC schedule is the recommended schedule. I put that in quotation marks because if you're going to honor informed consent, then you also do have to allow parents to make their own decision about this. Otherwise, there is no informed consent if it's just one size fits all. Some of you who know Dr. Paul and my practice, that we are really strong on informed consent. But we do tell people what is the recommended schedule, which is the CDC schedule. I wanted to thank you guys for sharing this visit.
Yeah, of course.
What an awesome,
of course.
healthy 2-month-old baby here.
Yeah.
Thank you for having us.
We're happy
my
to have you
gosh.
as her doctor.
Yes.
Thank you.
We're delighted to have you. You guys, thanks for watching. If comments happen to be turned on, let's have lots of thumbs up and positives here for a family that's willing to share this journey with us. I'm Dr. Paul. You guys take care.
Bye, little baby.
Say bye, Tosh. You like the camera. Say hi. I'm going to be a star.
See if you can. She's looking at Daddy now. Oh, there I am.
You see, Tosh?